This is a very simplified model of the way the pharmaceutical industry works for distributing your blood pressure medicine, whatever, to end users. And so it's basically a Pharmco, and I'm only doing unit one of everybody, but clearly for all of these things are units many. So you have a pharmacy company, they ship their stuff to a big distribution company, and your Krogers of the world get large quantities of pellets from them. And one of the things that's not well known is it's all a guess about how much you need to buy on any given monthly basis. If they buy too much or they don't buy enough, they actually end up dealing with these little aftermarket pharmacy distributors. And they'll either send them their excess or buy overstock from somebody else. And then obviously, you've got little providers, Cancer Place in West Virginia, they tend to get their goods from little distribution companies simply because they're not big enough to interest the big distribution companies. So this is the way it works. Overall, perfect world, no problem. These little aftermarket distribution companies are a huge problem in terms of they can get their goods from anywhere, and they deal with a bunch of other little ones. Any one of those can be getting drugs from India or relabeled expired meds that have been repackaged to look reasonable. And these little providers actually are sometimes notorious for taking particularly cancer drugs, which are insanely expensive, and then diluting them and giving them 1 unit of drug to 10 patients, and then none of the patients get better. Blockchain becomes appropriate because this is something you actually want to track from production all the way through the actual end user doses. And you motivate, people are interested in that, or not just the consumer, that you're getting good drugs, but the insurance companies who are funding the whole thing, they want to be able to, they want to know that they paid for the actual good thing that the customer got. When we were talking this morning, we went through 2 sets of cases. One, which is what Lawrence took on, which is things that are in paper, and you don't have to touch existing ERP inventory systems. And then there are things like this that this is all mediated by computers. It's all automated ordering. This, while it seems really obvious that you want to go do this and be able to track it, has to integrate with the existing systems, which as an implementation detail makes it considerably more complex. But the trade-off for this is that the problems of fraud, the problems of waste, blah, 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 do have a regulatory interest that drives companies to need solutions for it, because by fiat it says, thou shalt go do this. And you wanted us to go through details about what the system changes have to have happen. But first, let's do specific questions on this if we have any.
So I guess, for any asset tracking mechanism, I guess you need a source that you can trust. And is Pharmco there, I guess, fairly well trustable? Is it kind of like a CA equivalent, would you say?
Well, so again, we're only talking about is what's in this pill. Well, I'm not talking about is this pill actually good for you? Does it do what it does? But if what's in the pill, they have to be trusted. In terms of the actual, that the meds have the meds on the label, I think they're generally trusted. In terms of, are they marketing things that really have the value, and are they tracking the side effects? Then no, they're not. And that's a different opportunity actually for blockchain, but it's not the one that we raised.
I just want to add what Rolland was saying. The trust part on, Pharmco, usually what these guys they publish papers on various reputable or whatever the sites they call. So if they don't know the side effect of any drugs, they go to the secondary reputable publishing sites. That's what I think there was a big fiasco happened a few months back. There's a company in Hyderabad, they do all these kind of things. And all the big pharmaceutical companies, they go there to publish their paper to approve, to get the approval from FDA. So I think whole chain, including the publishing a paper, including the substance in a particular pill, is a good candidate for pharmaceutical, but it's a pretty long shot though.
So first off, we're adding some of this is guesswork, and so it's conjectural. So first off, at the pallet level, you're adding some pallet level tracking, and presumably this is RFID of some form, and it's got, whether you want to call it invoice, a bill of lading, but we'll call it bill of lading, and it has a bunch of actual packaging, and these are down to some scannable, whether it's, yes, thank you, QR code that's associated with each one of these, so it's a unique QR code. There's some form of identification of everything that's in there. And there are drugs that, like albuterol, will be individually packaged in a sealed container. And then you have other medicines that they come in big bottles, and then those big bottles get put in smaller bottles at retail. But so these may be in-user packaging, or it may be packaging for the pharmacists themselves. In any case, there's QR codes here. These pallets here may be one thing, they may be several things, but here they'll get broken out. So there is a change of your shipping invoice to include this bill of lading, which would be recorded on the blockchain. Then these guys down, as they break up and redistribute pallets, will also be doing something internally, saying, we took this, we broke it out this way, it went in a box and it went through here on some UPS, blah, 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 and some date. These guys here then, if it's an individual med, then they're actually tracking it. This QR code number whatever went to customer number 100 and whatever on date such and so forth. And so they're burning through the list that they got, and all of these transactions at retail are being recorded to the blockchain. So that's potentially, that's not necessarily the point of sale system, because the system that they actually use for tracking what drugs go to what patients isn't the point of sale system. It interfaces with it, but it's not the point of sale system. But there's a tracking system here. And just, I know my pharmacy actually then reports out to, like Overlake Hospital.
Yeah, so I was going to ask that gets reported to some medical services provider and an insurance company.
Bingo. Yes. Obviously, then, if this gets sent out back here, then it's some other list of QR, which means their shipping system needs to have a special reader to read these and ship them out. And again, if it comes in a big bottle, as that 50 or 100 of those get dispensed to a given patient, then that's a separate tracking went there. But it's still, patient whatever got this many pills from that bottle. Okay, so we come over here. So we're now into this case, and here we've got.
If the expensive drug gets split from one pill into 10, like you referred to earlier, how does that get detected?
Okay, so a lot of the ones that are getting split, these are actually, they'll be infusions of some form. So it'll be a liquid drug. And, the details of how they're doing the actual cut and paste, but it's still, this comes down to a QR code that, same as for over here, it gets reported to the insurance company, it gets reported to the provider that this patient got this dose on this date. And this is all getting recorded to the blockchain, and that's simply a double counting problem. You can't give the same QR code to that. That doesn't prevent you from not giving the guy stuff and passing it off to your buddy, but the motivation for doing that is considerably reduced than if you can just buy one of these and give them to 10 patients, and then you charge $500,000 and your costs were only 50.
Okay.
And if somebody receives fraudulent product, it comes with a QR code that tracks it back, so you could be able to tell, where along the chain it got you replaced, or at least you'd be able to specify the chain where it got replaced, right? So it's one of these 5 guys, and then we can go and look into their systems and see which one of them is, got extra money in the bank account.
Yeah.
So specifically, nothing prevents somebody in the factory from copying this QR code and sending it over there. And this goes back to, having tamper-proof labeling and having a QR code that you can't, if you open it, then the QR code is no longer valid, et cetera, et cetera. But it's still, you're relying on the analytics of the blockchain to detect that somebody is not dealing with the QR codes correctly, and but you are relying on a third party to go and go, aha. But in this case, we have the insurance companies as a motivated third party to go do that.
So I'm curious with respect to, I mean, it feels like there's a provenance solution waiting to happen, and then there's a specialization of the provenance solution that goes to this market and the art market and the diamond market, and so how do we split this and factor this so that one could have a decent rollout against a bunch of these different provenance?
So that is a great question, and we have a great answer, is that we were told to look at verticals and horizontals is tomorrow. So, I mean, and I'm serious, I don't mean to be sarcastic. So there are a number of horizontals that we looked at. Identity, wallets, et cetera, is one. Analytics tools is another. Provenance is a third. Those are all horizontals that you can build verticals on. So your point's excellent, but we did what we were told to do.
No, understood. I'm just asking.
Yeah.
I got another question, which was, oh, really? It's just like sort of before I asked, why don't you just use? Okay.
Great.
The earlier question was, why don't you just use PDF signing or web sites and stuff like that? And the answer was, well, there's all these different organizations and they're hard to keep track of and stuff like that. Isn't this reduction to previously unsolved problem? Now we got to do name systems or public key infrastructure or whatever for all these people.
Well, yeah, that's actually going to be, I guess it's sort of like related to my question, which was the same kind of thing. If you've got all these different stakeholders, I guess, in this system, but none of them, I guess, care about the integrity of the system as a whole. So who's the one driving all of the, you have to have this recording in the blockchain, and you have to make sure that you are checking this part of the blockchain. Like,
got to be regulatory oversight.
Right. So I think three questions are in play here.
I actually think this is one example where regulatory oversight I think this is one example where regulatory oversight's really not required because, as you said, the insurance companies are paying for all of this, right? And they know that they're being massively defrauded, right? And yeah, so and they don't have to, and they could do it incrementally, right? They could start at the factory, and they could say, listen, you guys just have to put tamper-resistant packaging on all of your boxes, right? We're not going to do the big. Maybe we don't do the infusions or something, but we're going to start small. And anything that you individually package has to have a tamper-resistant package with a blockchain QR code on it, starting in a year and a half, right? And then we can track that particular item, all the way down. We're not going to do it immediately, but eventually we'll get there, right? And then they can push on the fraud angle, and it's reducing their fraud risk.
So your idea is that the insurance company drives all of the changes, if slowly over time, because the insurance company has sort of the one stake in the system as a whole.
The insurance company is like literally the anti-fraud agent in this system, right? Like that's their whole function in this economy, right? In the drug economy, their job is to minimize risk, right, and to manage risk. And so they hold all the economic leverage here. They can say you have to do this in order to allow us to manage risk, then boom, it's going to get done eventually. You get a regulatory function that also hammers from the other side. Right.
So then I defer back to my original question, which was, if one entity is driving all of this change because that one entity is the one benefiting from it, why don't they centralize? Why don't they just have a database that, right? If one entity is driving the reporting requirements, that entity can just have a centralized database.
Because it's not one entity; it's a collection of mutually distrustful entities, right? So there's a dozen insurance companies, giant insurance companies in the United States, and some that are statewide and so on, and none of them trust each other. But they would all like a system that did exactly this, where they trusted the system, even though they don't trust any individual participant.
So if we continue with, so I mean, this might be something that's like obvious tangentially, but it seems like you could do some interesting I guess, supply conservation, sort of like how energy is conserved in physics, where, if you trust Farmco, and let's say they gave out 100 grams of, chemical X into their pill or something, then you can always sort of add up as it goes down the supply chain, like how those 100 grams are sort of distributed. And that's sort of what you're doing with your QR codes, but like, it's nice if you can explicitly specify the amounts so that at each step, that, let's say, I don't know, big distro, they use up like 99 grams. And so that, if they try to produce 2 more grams of chemical X, then they have to have the quantity come from somewhere. And that's
You can do that privately too.
Yeah, that's true. I guess you can infer it from the QR codes, but it's nice to kind of, have the system implement that, so to speak.
Right, and that answers the question I think you were raising. Why isn't this just a PDF management problem? Is because it is a double bookings problem. You want to prevent that problem. And to answer your question, is that has to be part of the system because it may not be at the distributor because it's individually packaged, and it doesn't at the distributor level. It doesn't matter if it's individually packaged in a bottle of 1,000 or in a box of 30 that's hermetically sealed. Somewhere down here, that box of 2,000 gets broken out into individual patients, whether it's the hospital pharmacy, your local pharmacy, wherever. So both methods of tracking have to be available at different points in the system.
So despite my love for regulation, I think there are more entities here who have an interest than just the insurance company. Even with this simple example, if something is being diluted at the demand point, at the very end, then in order for no one to get caught doing something wrong, one of two things has to happen, right? Either that has to stop and they only have one to distribute, or they need to buy 9 more.
Right.
Right? One of those outcomes benefits the insurance company and one doesn't. One benefits Farmco and one doesn't. So I think that there's a nice symmetric pair of interests.
Right. And
regulation would be great too.
But so one of the things that we liked about this is I think you were saying is there are a bunch of different places. You can start with the infusion because that's the big ticket item that kills people fast. Or you can start with just doing this and making these guys' life uncomfortable because that's one of the other primary places that bad drugs get into the system. And then expands gradually to the big world goes back to Farmco's bad behavior, which isn't not putting bad drugs into the system, but putting drugs in the system where, as Navneet said, they're hiding the side effects that are bad. And if you've got this and you've got in your patient records, you know exactly what batch of what is coming from where, and not just this guy was on this generic version of somewhere, but what factory and what date, then you can start doing the in-field tracking of all of your side effects, et cetera, et cetera.
So I want to. I'm not a big fan of the entire system entirely. I mean,
I don't think anybody is.
Yeah. I would love to ask questions like how does blockchain help to disrupt some of this? But let me take it less radical. I've been working with some principals at Amgen for a number of years now, and they are now at the point where they have field tested personal dosaging regimes, based upon the same formal methods that we're using to do our blockchain design. And so they're interested in talking to us, but suddenly that's a very different game because now it's Amgen, Amgen and the physicians and the patients, and that's it. No insurance company? Well, there's going to be some insurance company, but they can't go through Kroger, right? It's not something that they want to do, at least not at this point, right? So how do we future-proof this, because I feel like as personalized medicine comes into the picture, more and more, there are going to be different players on that picture, different players on the field. Does this make sense? Do you understand what I'm saying?
So the example I would give, so I don't, if you've been paying attention to it, there is a cover story on Time of personalized medicine is here, and there's a picture of Evan, who is a lung cancer survivor. And he had for years been he would go in and get biopsies, and they would run, literally 1,000 different mixtures of chemotherapy drugs against his actual biopsies, figure out which ones were most effective with the least side effects, and then give him that. And he survived for close to 15 years on like a 6-month diagnosis from his lung cancer. And so that is absolutely real, and it will be disruptive because it disrupts not just Farmco's one dose fits all, where it really doesn't. We're tracking at an individual level what works, which gives feedback into the system of what works, it doesn't work. It opens it up to smaller players who may be willing to do, more able to do signups of smaller field trials, and getting, closing the 3 or 4 year study pipeline to make it fast. Because if you've got, as you would in Evan's case, you got 6 months left to live, you got nothing to lose by trying an experimental regime. Well, for Amgen, sure, but what if your customer, it's in India or China or Germany who is producing these, and you're not. I mean, I'm not knocking Amgen, but Amgen is far from the only set of companies that will want to participate in that, and you want to be able to.
So think about it this way. There's two different cases here, right? One of them is that like right now in this country we have a massive problem with opiates being misdistributed, right? And it's such a huge problem, it's actually affecting life expectancies in this country, right? You can actually see it in the aggregate statistics. So having a solution, any kind of solution, you can guarantee that you knew more or less where opiates were going, right, is a massive public health win, right? Now that doesn't address the personalized medicine, but there is no personalized medicine plan for opiates, right? They work great on everyone. Right, so when you need to use them, the ones that we have work really well, right? And they're not, when they talk about personalized medicine, they're not talking about personally modifying the OxyContin formulation on an individual basis, right? It's for cancer drugs and things like that. So that's, or whatever. That's a separate, I think, different problem. What I liked about this example is it demonstrated really clearly how you can integrate physical security controls like a tamper-proof QR code on packaging with a ledger system for tracking product to ensure a kind of product safety that's not possible to ensure today, right? And that I think is why this particular application is fairly compelling.
So I think you're asking the question, which we've talked about. We actually have another one that I would love, because I know you care about carbon and that sort of stuff. Would love to run past you that. Has to do with retail sales, because down here Kroger doesn't want anybody knowing at a store level how many whatevers they sell on a given basis, and I think that's a solvable problem in terms of how you write data to the code. But these guys are giving me the crazy thing, so we're going to quit. Good question. I think it's solvable.